Pathology of sepsis. Now, the pathology of sepsis. First of all, the sepsis, before we starting with the definition, let's talk about the complication. Why we are studying it, why it's important studying it, because it can lead to disseminated intravascular coagulation and multi-organ damage and failure, and then lead to death due to the multi-organ failure. Now, sepsis is what? Sepsis is a systemic response to infection, okay? And what do I mean by infection? Inflammatory response to the presence of the microorganism. That means that you are having an organism in your body and you are trying, here this is your organism, okay? And your body is trying to fight this organism by WBC and cytokines, okay? This is number one. This is the first principal important point. Then, number two, they will be what? They will be local. This is local, right? So this is local, not generalized. Now, if I'm telling you this is local, see, inflammatory response to the presence of microorganism. This is local. This is the definition of infection. But if you are talking about sepsis, you only add this word, systemic. That means this response, the vasodilation and the other things, they will be in the whole body, so it is systemic involvement. That's why it's very severe. Now, SIRS, which is systemic inflammatory response syndrome, this is like a different criteria, and I will explain it in another video. This is a criteria that will tell you that okay, you are entering sepsis, but how you can tell that okay, this is sepsis. Now, if SIRS criteria was accomplished with the infection, it will be sepsis. But if you are having SIRS, and like SIRS can be result from many conditions, like if you have burn, if you have trauma, if you have pancreatitis. In this case, we will not call it sepsis. But if there is infection, you will call it sepsis. Okay. Now, if there is localized, okay, you will tell me, okay, this is localized infection. How does it turn to the generalized? Well, let me tell you that the localized infection is one of the triggers of sepsis, because it does not have to be like it doesn't have to be in every area you will have microorganism. No, there is response, systemic response. Your body is responding, your WBC is responding in an unorganized way. Okay, so here if you are having infection and you have SIRS, systemic inflammatory response syndrome, okay, these two criteria together we will call it sepsis. Okay, without infection we will not call it sepsis. Systemic inflammatory response syndrome is defined, let me tell you in brief words, that there is temperature more than 38 or more than less than 36, respiratory rate more than 20, heart rate more than 90, WBC is very high or very low, and yeah, this is the criteria. Okay, so if there is two criteria from this and there is infection, in this case you will call it sepsis. Now let's look at severe sepsis. Severe sepsis, it simply means that there is organ damage. Now severe sepsis is a very old term. Okay, this is very old definition, but we'll use it here. And lastly, we'll have septic shock. Septic shock simply means that there is severe sepsis with hypotension and too much lactic acid in your body. Now, we finished from sepsis. We finished from what? Sepsis. Now, I'm entering in another definition, which is shock. Remember, shock is not sepsis. Now, shock can result from extensive trauma, from burns, from blood loss, from pulmonary emboli, from sepsis, any severe condition, it will lead to shock. Now, what do I mean by shock? Shock is systemic hypoperfusion to the tissue. Now, why there is systemic hypoperfusion? It's because either from the low cardiac output or there is less effective circulatory blood volume. That means not every part of your body will get good blood volume. Okay, so this is, we call it as shock. Even though they will get the blood, but they will receive it, but it's very low, or maybe there is a defect. Anyway, so now our case here today, we will talk about septic shock, okay, which is a very dangerous one. Now let's look at the microorganism, how macrophage will recognize it. Now this is your blood vessels, and this is your tissue damage, and here this is your microorganism. This is your polymorphonuclei want to go to the tissue to eat the bacteria. Now the macrophage are sitting here because if you know, tissue macrophage are fixed in tissue, some of them, and some of them is circulating. Now this macrophage will see the bacteria and said, okay, I'm going to express tool-like receptor TLR, and the bacteria will have lipopolysaccharide if it is negative, and if it is positive, gram-positive, it will have peptidoglycan or exotoxin. In this case, this PG, exotoxin, lipopolysaccharide, any antigenic pathogen, pathogen that have antigen, we will call it BAMP. That means pathogen-associated molecular pattern. These things will be recognized by the tool-like receptor on the surface of macrophage, and thus will lead to the signal transduction, affect the DNA, and thus will lead to the formation by translation and transcription to the tumor necrosis factor interleukin-1 that will lead to the tissue change here. It will lead to acute inflammation, and then it will lead to shock, sepsis, if there is the things that we will talk about it now. Now, what do I mean by septic shock? Septic shock is here. Hypotension, severe sepsis, and lactic acidosis very high. Now, wait. There is a new definition. What is the new definition? It is a subset of sepsis. That there is a profound circulation, cellular metabolism abnormalities that basically will lead to increased mortality, more than 40. If you are talking about only sepsis, it's more than 10, the mortality. But severe septic shock, there's more than 40, okay? Now, this is the clinical condition. There's despite giving this vasopressor, that means the agent which like epinephrine constrict the blood vessels, the mean arterial pressure is very low. And despite adequate perfusion, in another word, there is no hypovolemia, there will be high lactic acid. In this case, we can call it as septic shock. Inflammatory reaction. C, cellular activation. C, cytokines, nitric oxide from the endothelial cell will lead to vasodilation. Vasodilation will lead to what? Vasodilation will lead to venous blood pooling. That means less blood flow to the heart, and there is a hypermeability because of the, we will talk about it in the next slide. Systemic effect of the cytokines and the nitric oxide, less contractility of the heart. Fever, leukocytosis because of what? Cytokines. In the same time, this inflammatory reaction can activate complement and coagulation cascade. Why? See, the cytokines will lead to tissue factor formation. Tissue factor formation will lead to coagulation, okay? And complement activation because of what? Because of the inflammatory cytokines and other things. Anyway, there will be DIC, disseminated intravascular coagulation, because too much coagulation, and lastly there will be reduced tissue perfusion. So the vascular effect, vasodilation, in the same time DIC will lead to reduced tissue perfusion, and thus will lead to organ failure. How I know if I have organ failure? There is lactic acidosis because of the tissue hypoxia. There is this cardiac output. There is heart failure, can lead to heart failure, acute respiratory distress syndrome, altered mentination, which is mental symptoms, and can lead to coma, and oliguria, anuria because of kidney failure. Why? Because of what? Because of reduced tissue perfusion, and thus will lead to the old-term severe sepsis. Now look, severe sepsis, organ dysfunction, that's it, right? Now organ dysfunction, today we call it here systemic response to infection, and there is concomitant, with it there is organ dysfunction. So this is the new definition of sepsis, okay? So this is old definition. Now this just telling you the blood vessel defects in sepsis, the thrombosis. Why in sepsis you have thrombosis? Because there is stasis of the blood. Why? Because there is vasodilation, so the blood will not move. Anticoagulant is very low. Why? Because the endothelial cell is damaged that will produce anticoagulant. Coagulant too much. Why? Because of the pro-inflammatory cytokines that's secreted from the macrophage, and because tissue factor promote tissue factor here. I told you here. Okay, here. See, tissue factor from the cytokines will lead to disseminated intravascular coagulation. In other words, this is the pathogenesis of PIC. Permeability. Why? Because of the tissue. Permeability because cytokines will affect the V-cadherin. The V-cadherin is an adhesion molecule between the endothelial cell. If affected, it will lead to tissue edema because there is exudate, and there will be the waste. The waste will be less removal. Why? You know why? Well, if you say that's because there is too much space here, too much exudate. So the blood will not be able to circulate and remove the waste, and there will be less oxygen transportation. Okay. Now, vasodilation because nitric oxide coming from the endothelial cell, and there will be vasoactive inflammatory secreting from the circulating leukocytes. DIC, I'm sorry for the handwriting. Vasodilation because of the cytokines, and less cardiac output will contribute to the hypoperfusion, and thus will lead to tissue hypoxia and aerobic glycolysis. Why? Because there is no oxygen, so there will be only 2 ATP instead of 24 ATP generation because there is less oxygen. Too much acid will accumulate in the tissue, and this acid will contribute because one of the shock in the shock compensatory process, there will be sympathetic nervous system will lead to vasoconstriction to lead to increased cardiac output. In this case, there will be stop of this effect, so there will not be effective sympathetic stimulation. Lastly, you have tumor necrosis factor, interleukin-1, and because you are in stress, this all mediator will be secreted, and this will lead to gluconeogenesis. This will promote gluconeogenesis. There will be too much glucose. In the same time, the cytokines will affect the tissue and lead to insulin resistance, and thus will lead to what? High glucose. High glucose, unfortunately, will lead polymorphonuclei neutrophil will cry, and thus will lead to less function. And the endothelial cell are trying to recruit the BMN to the site of inflammation, and in this case it will increase the adhesion molecule and increase the procoagulate state in order just to compensate, and this will lead to too much thrombosis. And the next video will be talking about the immunity and the phagocytosis, and thank you so much.